Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editor's highlights and a summary of our open access publications available.
Advances in inflammatory skin disease management are rapidly redefining dermatologic practice. Our June issue presents a compelling framework unifying type 2 inflammation across conditions like atopic dermatitis, prurigo nodularis, and chronic urticaria, emphasizing shared cytokine pathways and therapeutic opportunities. Also featured here is new real-world evidence supporting dupilumab efficacy following tralokinumab failure. In psoriasis, a novel step-down treatment strategy advocates for earlier biologic use in younger patients, followed by de-escalation. A paired commentary tempers this proposal with methodological and practical concerns. Finally, data on bimekizumab's safety and effectiveness in patients with chronic kidney disease address a critical clinical gap. These contributions highlight a shift toward precision medicine, integrating immunologic insight with patient age, comorbidity profiles, and therapeutic sequencing to inform truly individualized care.
A highlighted open access review by Chovatia et al. Explores type 2 inflammation in various dermatologic conditions. Atopic dermatitis, prurigo nodularis, and chronic spontaneous urticaria are immune-mediated, inflammatory skin conditions characterized by intense itch and disease-specific skin lesions. Despite their different clinical presentations, the three diseases are unified by an aberrant type 2 immune response involving type 2 cytokines, immune cells, and sensory nerves that may underlie their shared clinical manifestations of inflammation and pruritus. The chronic nature of these conditions is associated with significant impairment in patients' quality of life and psychological disorders, such as anxiety and depression. Understanding the shared immune mechanisms that underlie these seemingly distinct skin diseases and other concomitant inflammatory conditions is critical for applying therapeutic interventions targeting the type 2 immune pathway.
Another noteworthy contribution by Torgman et al. Discusses nail disorders in patients with skin of color. This systematic review aims to synthesize the clinical and onychoscopic features of inflammatory nail disorders in patients with skin of color, enhancing diagnostic accuracy and patient outcomes. Studies documenting clinical and onychoscopic features of inflammatory nail disorders in Fitzpatrick skin types 4 to 6 were included. Data extraction focused on study design, patient demographics, diagnostic methods, and nail findings. Of the 608 articles identified, 60 met the inclusion criteria, encompassing 16 inflammatory nail disorders and 12,743 patient cases. Key disorders included nail psoriasis, nail lichen planus, alopecia areata, associated nail changes, and others. Significant variability was noted in reporting skin type, with only a minority explicitly documenting skin of color representation. This review underscores the paucity of literature on inflammatory nail disorders in skin of color, highlighting gaps in clinical documentation and diagnostic approaches. Improved awareness and inclusion of skin of color in dermatologic research are critical to addressing these disparities and enhancing health equity. Recognition of diverse clinical presentations in skin of color patients is essential for accurate and timely diagnosis of inflammatory nail disorders.
Further in this section, Yadlapati et al. Reviewed Mohs micrographic surgery versus wide local excision in the treatment of anogenital squamous cell carcinoma. Primary anogenital squamous cell carcinoma is a locally aggressive malignancy that requires careful consideration of surgical margins. Anogenital SCC impacts quality of life due to tissue removal, scarring, and sexual dysfunction. Mohs micrographic surgery, or MMS, offers a compelling alternative to wide local excision, WLE, due to its complete margin control and potential tissue-sparing properties. This analysis systematically reviews surgical modalities used for the management of anogenital SCC. All studies investigating surgical management of anogenital SCC with wide local excision, including vulvectomy, or Mohs micrographic surgery were considered. A total of 70 studies met inclusion criteria. 46 examined WLE patients, 8 utilized vulvectomy, and 24 examined MMS patients. MMS patients experienced lower local recurrence rates. Regional and distant recurrence rates did not differ. The local, regional, and distant recurrence rates for WLE were 17.7%, 5.1%, and 6.0% respectively, and 5.0%, 3.8%, and 0.0%, 4.3% for MMS. Local recurrence was more likely in patients treated with WLE. No differences were noted in regional recurrence and distant recurrence. Study limitations include differences in tumor characteristics and follow-up durations between the groups. The WLE group had larger tumors at presentation. Overall, MMS had superior outcomes for local recurrence compared to WLE and vulvectomy, making it a reasonable option for managing anogenital SCC.
In an original article, Baylock et al. Propose a step-down approach to biological therapy in younger psoriasis patients. Psoriasis is a chronic autoimmune skin disorder affecting roughly 2% of the population worldwide. This condition manifests variably due to individual phenotypes. As the number of therapies has increased, Belgium established its own registry. However, these treatments are often inaccessible due to reimbursement criteria. This study suggests that some groups of psoriasis patients, particularly younger patients, may selectively benefit from early treatment approaches with biological therapies. Patients diagnosed with psoriasis included in the Belgian Psoriasis Registry were included in the study. Collected data included sociodemographic changes, lifestyle changes, psoriasis-related characteristics, treatment specifics, and treatment changes, and associated diseases. 205 patients were included. Patients were classified as responders if their Psoriasis Area Severity Index, or PASI, score decreased by more than 75% between the initial visit and follow-up. 47% of patients achieved PASI 75. In the short term, 50% of patients treated with biologic therapy, 30.5% on systemic conventional therapies, and 32.25% on topicals or phototherapy responded with PASI 75. At long-term follow-up, an increase in response was observed in patients receiving biologic therapy, as well as in patients undergoing systemic conventional therapy. Patients receiving treatment shortly after their first lesion's onset had better responses. According to the authors, intervening earlier with effective treatments improves outcomes, particularly in younger patients. Treatment algorithms should use a step-down approach rather than a step-up approach. This would enhance the number of responders and potentially reduce costs.
An open-access original article by Pazgai et al. Evaluated the cutaneous side effects of PD-1 inhibitors. The introduction of immune checkpoint inhibitors, ICIs, opened a new era in cancer immunotherapy. In particular, PD-1 inhibitors have shown remarkable efficacy in various cancers, most notably melanoma. However, the widespread use of immune checkpoint inhibitors comes with the challenge of immune-related adverse events, with cutaneous toxicities being the most prevalent. The authors carried out a retrospective single-center study to investigate the cutaneous side effects in patients diagnosed with melanoma and treated with the PD-1 inhibitors, pembrolizumab or nivolumab at the Department of Dermatology, Venereology, and Oncodermatology of the University of Pec, Hungary. The study included patients with stage 3 or 4 melanoma who received PD-1 inhibitor monotherapy either for metastatic or adjuvant purposes from August 2015 to May 2022. A cohort of 174 patients was examined, with 29% experiencing cutaneous adverse events. The most prevalent cutaneous toxicities were vitiligo in 18 patients, maculopapular rash in 14, pruritus in 14, xerostomia in 8, and lichenoid dermatitis in 4. Treatment primarily involved topical corticosteroids and emollients, with a few cases requiring systemic therapy. Notably, the occurrence of dermatologic adverse events was associated with improved progression-free survival and overall survival compared to those without any skin toxicity, emphasizing their potential prognostic significance. The data were not influenced by any well-known prognostic factors of melanoma. This study contributes to the growing body of evidence supporting the prognostic value of cutaneous adverse events in patients treated with PD-1 inhibitors. Optimizing treatment strategies while maintaining oncologic therapy is essential, highlighting the role of dermatologists in multidisciplinary cancer care.
Our June issue also features 2 open-access short communications. Cumprensiotis et al. Investigated bimekizumab in psoriasis patients with previous exposure to interleukin-17 inhibitors. The therapeutic options for patients suffering from moderate to severe plaque psoriasis have expanded considerably in recent years. Despite that, treatment failure can be expected in a considerable number of patients, constantly challenging physicians to choose the next best alternative. According to the available literature, switching within the class of interleukin-17 inhibitors, also known as intra-class switching, has proved to be a successful tactic. Data regarding the recently approved interleukin-17 AF inhibitor, bimekizumab, in patients with previous exposure to an interleukin-17 inhibitor remain limited. Therefore, the authors aim to assess whether switching to bimekizumab after the failure of a previous interleukin-17 inhibitor is an effective and safe option in a real-world setting over 1 year. The results agree with previously published real-world and clinical trial data and demonstrate the effectiveness and safety of bimekizumab, irrespective of prior exposure to interleukin 17 inhibitors for a long follow-up period of up to 1 year.
In the second short communication article, Fratton et al. Studied the use of bimekizumab in a patient cohort with plaque-type psoriasis and chronic kidney disease over 48 weeks. Psoriasis is associated with an increased risk of chronic kidney disease, or CKD, with a prevalence of 1 to 8%. While biologics generally do not alter renal function, no data on bimekizumab are currently available for patients with CKD. This 48-week retrospective study across 3 Italian dermatological centers assessed the efficacy and safety of bimekizumab in patients with moderate to severe psoriasis and chronic kidney disease, alongside its impact on renal function. The study suggests that bimekizumab effectively treats moderate to severe psoriasis in patients with chronic kidney disease. While outcomes at week 48 were comparable to other real-world studies, early PASI responses at weeks 4 and 16 were slower, suggesting a possible impact of CKD on treatment outcomes, a finding that had not been documented before. Finally, adverse events were frequent, consistent with what has already been described in patients with renal impairment. While candidiasis has been extensively described as one of the common adverse events associated with bimekizumab treatment, the association with the other adverse events described in this study is not as strong.
This was the June episode of IJD in Focus. Thank you for listening. Until next time.